Hello, welcome this evening. Welcome to our fourth COVID Facts Not Fear town hall discussion. This is our final in this particular series, sponsored by the African American Council of Elders and the Black Alliance. We're just going to talk a little bit about COVID and what's going on right now. Currently, with regard to the pandemic nationwide, there are about 19 million cases with about 332,000 deaths at this point. In the state of Kansas, we have about 213 cases with about 2,500 deaths. And in Sedgwick County, we are about 37,000 cases with 256 deaths. Right now, unfortunately, we are leading in the state of Kansas. But we continue to work hard here in Wichita to do what we can to combat COVID and keep our cases and deaths down. The Council of Elders and the Black Alliance have continued with our collaborative Facts Not Fear outreach, education, and assistance campaign. One part of this campaign has been our free text alert system. And if you watch along the bottom, there will be on that ticker, it'll tell you how to get onto that text, but that you dial 484848 to get updates on healthcare and other issues that are important to the Black community within Wichita and the surrounding areas. Also part of the Facts Not Fear campaign has been a series of virtual town hall discussions to provide not only the African American community in Wichita with valuable information, but Black communities nationwide with what we all know in order to make sure that we survive. As we have been talking about all of this, one of the things that we really are trying to emphasize is that we're all in this together. At the end of the day, whether you're Black, whether you're brown, whether you're white, whether you are whoever, if you live in this community, if you live in this nation, this is affecting you in some way. Last week, we discussed the effects of the pandemic on mental health in our communities, and tonight, with the introduction of several COVID vaccines, we want to discuss the very serious issue of should Black and brown people take the COVID vaccine, why or why not? Tonight, we have a couple of panelists on for you. Our first panelist is Dr. Rita Stanley. We talked to her last week. She is a Kansas City-based internal medicine specialist offering alternative and holistic health services. Welcome, Dr. Stanley.
Thank you. Very good.
Next, we have Dr. Reagan Dehart. She is a family practice physician with the Grace Med Health Clinic here in Wichita.
Good evening.
Welcome, Dr. Dehart.
Thank you.
All right, we also have Doris Duggins. He is a family physician with Ascension Via Christi Medical Center in Wichita. Welcome, Dr. Duggins.
Thank you, Van. It's good to be here.
All right, and our last but not least is Dr. Dennis Oyango. He is a pulmonary and critical care specialist at Ascension Via Christi. Welcome, Dr. Dennis.
Thank you so much. I'm happy tonight.
Awesome. We are going to have a great discussion, and we want to remind you that because we are live, because we are on Facebook, feel free to pop your questions in there. Feel free to ask questions. We want to make sure that your questions are being answered. Of course, I have some questions, but we want to make sure that we are answering your questions. All right, my first question is going to go to Dr. Dehart. And I know that you are in a clinic, and because of that, you're working with families. In that clinic, you're dealing with African American and Hispanic families. What are you telling patients about the vaccine?
Well, I tell them that it's safe. I've already had my vaccine last week. The only thing I experienced was a little bit of muscle pain in my arm for a couple of days. If you have to weigh the risk against the benefits. Our risk is becoming very ill, if not dying, versus the benefit of living. We are at that point where we are getting close to its life or its death. We still don't know what we don't know about this disease. We don't know who it's going to affect in the most severe manner. So we have to take it. Got to take it.
As you're looking at those populations, so as you're looking at the various populations that are coming to clinic, is there a particular thing that you're seeing in common with your patients?
Absolutely, especially in our marginalized patients, our Black and our brown. We are the people that are working front lines, and the definition of front lines is living. You know, we thought police officers and firemen. We forgot about the people who clean in the hospital. We forgot people clean up in the store we frequent. And these are our who have lots of chronic health problems, who are already of socioeconomic status. They can't take off work. They don't have good pay. They have to support their families, so they work whether they are sick or well. And these are the populations that I serve. These are the populations who are at greatest risk right now.
Thank you. Thank you. I do agree that when we started to look at that idea of frontline workers, when we started to look at who people that are out there, we didn't think about the people that are getting our groceries, people that are cleaning, the people that are doing some of those jobs that we don't think about that are kind of undercover. But if they weren't them, we would have real issues. Getting the things that we do every day done. Even that person that's picking trash, because there's some level in which there can be some contamination there. So I think those are that we haven't thought about, and so I appreciate bringing that up. Dr. Yango, I understand that you at some point did contract the virus, correct? So tell us a little bit about what that experience was for you.
I think fevers and sweats and muscle aches, which is like, I didn't know what it was initially. I thought it was just something coming along, tried to shake it off. But the week before, I'd been taking care of a patient that was very sick, and I thought I'd been exposed to him. After 1 week of muscle aches and sweats, that's when I started having a cough and shortness of breath. And it was scary. The biggest thing was the anxiety of not knowing what to expect. And given my practice, I'd seen a lot of patients suffer and die from it. So I was also anxious, that the same before me. So it was a very trying moment, at least 3 or 4 days when I thought I was, the most sickest, with a lot of cough and shortness of breath. And then slowly things started getting better. And it was a relief that I felt like I was getting better after maybe a week or 2.
Wow. So as you think about that, was anybody else in your household affected?
No, not really. I live away from my family. My family's in Kansas City and Wichita. And I visit. But by the time I was visiting them, I was having symptoms. But I didn't know it was COVID at that time. So I was interacting with them as usual. And then when I came back, that's when I tested it. But luckily, I think by the time I was showing up there, I was probably not as infectious. So so it was a relief. All of them got negative. So I didn't expose anyone in this family.
So do we see that as being an issue in the fact, because the symptoms so similar to the things that we have going on anyway? So this feels like my allergies. This feels like maybe I worked out too much and I'm sore because maybe I have a little bit of the flu. So how are we telling people what are we doing and having those conversations so that people really realize that this is just the everyday of the meal things that they would be getting involved?
Unfortunately, it's very rare. Earlier on in the symptoms can be very mild. They can be muscle ache, maybe sweats, a bit of fever, and but people realize that they're sick, they will spread it to other persons. So to be very vigilant with mild symptoms, to be very vigilant that when any symptom that's unusual, they should think about getting tested. Unfortunately, people don't know. By the time people get sick, usually around day 10, day 14, their symptoms tend to be more severe, and people go inside. And by that time, they've already spread family, and their friends, and they've all been exposed. So the best thing that people can do in this time is to be more cautious by wearing your mask, staying out of rings, from exposing other persons that if you have it, because by the time you realize that you have already spread it.
So one more question for you, and then move on. I know that you are a pulmonary specialist, and a lot of this disease really affects our respiratory system. And I know from experiencing a person in our congregation that stroke happened as a side effect. So what are you seeing in the pulmonary respiratory situation that's happening?
So I would say that 9 months, they've been agonizing 9 months. We've seen a lot of suffering. People come in with shortness of breath, and initially when they come in, they're having a little bit of struggle. But as time goes by, disease is catching up with them. They get more and more short of breath to the point that we have to put them on a breathing aid to support the lungs. What the COVID does, because inflammation in your lungs get stiff. Usually the lungs are balloon, so it's very easy for you to in and out and breathe out. But as you get a lot of infection, the lungs get stiffer, it becomes more like leather. And so walk breathing becomes very difficult. In fact, today I was just sitting, and he was telling me, I try to breathe. I can't do this anymore. And he can't get any comfortable position, feel comfortable in his breathing. And I saw another gentleman as well, saying that, in his face, you can see a lot of despair. Initially, when he came in, he was very optimistic, but right, the disease is catching up with him and he's getting weaker and more. And you can sense that he's sensing that, maybe death is, so you can look in his eyes and you can fear, he's afraid coming. And fortunately, when you try to reassure him, you've seen a lot of the same cases, and you've seen what's happened to them. You can try to give him some hope, but the hope is not there. We know that more than not that he's going to breathe the machine and eventually possibly die. So the lung get really damaged, people get scarred, can stay in the hospital for more than 2 months, 3 months, and even then recover. They still need some time to recover their jobs, their livelihood. People have lost their family. So it's a multiple systems and multiple livelihoods in lives.
Do you see the question down below? How to take for your oxygen level to kind of level out?
Luckily, my oxygen level, got down to 92%. So it didn't go that low. And maybe because of my age, and being healthy, I would say, because I was a little bit active, I didn't get that sick. But all the persons who have other risk factors that we know about, right now we see people who have diabetes, who tend to be mostly African Americans, obese, the socioeconomic issues tend to be Africans, and older tend to have severe disease and not seeing in the hospital. They tend to get much more sicker, and the oxygen down. Usually, if you're going to recover, it will be probably around 2 to 3 weeks. I've seen some improvement. I've seen patients be sick for like 2 weeks. So.
Wow, Dr. Stanley, I see you saying yeah. What do you? I know that you're in that Topeka, Kansas City area. What are you seeing happen?
No, I'm not on the line, so I'm not in the hospital. I'm not in the ICU. I do more patient, functional medicine. But I've done telemedicine for the entirety of the pandemic. So back in March, April, May, just constant telephone calls from people who were having symptoms. They were just hearing about COVID, didn't know whether they had it, testing wasn't available. So spent a lot of time and had to learn rather rapidly about this new infection. I mean, it's a novel virus, and everybody has been learning along the way. So my experience has not been one-on-one in an office setting or hospital setting, but primarily on the telephone. And at one point, when New York was an epicenter, we actually had limited ability to actually practice. And I was talking to people in New York and New Hampshire and Delaware because their systems were so overwhelmed and people couldn't go into the ER. They couldn't go to their doctor.
Wow.
So a lot of it on education and helping people understand as much as we knew at the time, helping them understand the symptom. They can't ignore. Yes, the ER is full of COVID. If you're having shortness of can't breathe, you've got chest, you need to go to some in-person care. So lots of education, lots of encouragement. There's lots of anxiety on there. So what I've seen has been in role. It get better, but now it's ramping in. We're heading in flu season. If you were saying, people don't know, what is this? Is this my allergy? Is this flu? And literally, you cannot tell them, this is just your sinus. We can't, I can tell you, it sounds like it could be routine sinusitis, but in my mind at point, because there's the positivity are so high, it's COVID until proven otherwise. And I'm not trying to be paranoid that everything is COVID, because people still get common things. However, to me, the worst you can do is just to treat it with antibiotics, which are not going to have COVID, as far as I know, and not as an outpatient, and get them to get testing. And fortunately, in Kansas, or at least the Topeka area, testing in asymptomatic has become more, because up until the last couple of weeks,
right,
had symptoms in order to be tested.
True.
So it's going to be interesting, the positivity rate as the testing is widely available. I think the number down some, but for me, it's been a lot of support guidance, directing people to get care, when to get care, and also in my own personal practice, really people understand that they have power around some things, like what they're eating, about their vitamin D level. If you can't get it checked now, then still, based on a lot of the science that's coming out, pandemic, vitamin D can help in people of color. A lot of mine is just letting people know you do have some control. We don't have treatment for symptoms or asymptomatic, but you have control over in your body so that your immune will have a better time of doing what it to do.
So last week you brought when we talked about and you brought up something that at the end of the day, take it because I want to live. And Dr. Oyanga just said the same thing. So tell us a little bit about that. I think there's fear of the unknown. And so, the vaccine is unknown. We don't know. Dr. Hart said she took it. She didn't really necessarily have, but it's still new. It's a novel thing at this point. So, that ideal want to live. What are we having? How do we have those conversations?
Well, I understand why there's so much mistrust in it, especially based on some history. But I also think I think it's that we're in Kwanzaa. And I love the set principles of Kwanzaa and speak to this pandemic as far as I'm concerned.
I would agree.
Unity in the community, self-determining, making sure that it's a work. So when I say I live, I want to live for me and for the people around me. I want to live for the children, the older people. I do what is right for getting the vaccine, but I also want to help people as much as I can to really understand the facts of vaccines. And so we can rest some of these fears based on lack of real actual facts. So to live for me is to just live for me. For me to live means that other people live. That I'm proud.
Django, you wanted to say something on that? And then we'll see you, Dr. Duggins, I promise.
Oh, sure. I wanted to add what Dr. Stanley's mentioned. As it is right now, I think we have to talk about what the alternative is. The alternative, what we have right now, is that we have no effective treatment for COVID-19. COVID-19. So then, when you look at the suffering, and like I told the gentleman that I saw today, I'm sure if I offer them a vaccine, they'll be able to take it. Even right now, I think since March, maybe April, we've been called some kind of sort of vaccination we're using. It's called passive vaccine. What we're doing is we're taking other patients' plasma and giving it to patients who are sick. Unfortunately, that does not work very well because by the time you're giving it to you, you're sick with the disease. So it's there in your body before you see the disease, and so it's coming to you, at least you can fight it off. So the vaccination idea is always there, and we've been doing it already, but it's very ineffective what we're using. So what we have right now, I think it's the best so far that we should be running to.
Thank you. So, Dr. Duggins, I know you on Facebook the other. You got your nation, and you were getting it on Facebook. Tell about that.
Yeah, being in the frontline people, I figured I needed to go ahead and get my vaccine. It's not just for me, but to help protect the people around me, my family, and my community. The community itself needs to have an example that it's a safe vaccine to be taken. And if I'm going to put myself out there to take it, hopefully they'll recognize that it's, if I think it's safe, that hopefully they'll think it's also safe. It's been tested with thousands of people, and it has demonstrated good efficacy. So we just needed to get enough people comfortable with the idea of being vaccinated instead of dying from COVID, like so many have already. We unfortunately have 2 African American dying proportionately from COVID. Again, as Oyengo said earlier, and as Dr. Stanley and Dehart alluded to, there's a disease process that affects disproportionately. There is the fact that we have so many people that work in the service industry and as workers as well. So it's important to get the vaccine as soon as we available. I was only informed that they're bringing in the community through some of QHC, have the federal qualified health centers that we have in the community. So that's good. I think that we'll also get more people vaccinated.
So did you have any side effects?
My only side effect was the following day, I felt soreness in my left arm where I got shot. On that, nothing. It was all good from soreness in the deltoid. So I was good. I didn't have any weakness. I didn't have any slowdown in my work activities. I got a fever, nothing of the sort. Just went along with my regular activities.
So here's what we're going to kind of open it up. I'm going to just ask some questions because I want us to have a little bit more discussion. Okay, there is this whole concept that when you get a shot, when you get a vaccine, that they're giving you the disease. Is that true?
No, not really. The vaccine, there's different kind of vaccine. But this vaccine, what they're doing is they're giving you a protein that's similar to what it's kind of a precursor to a protein, that's similar to the virus. So you can get trained, by seeing this protein, which is a virus protein, and then your body then can learn with time to fight the virus when the virus comes through. The protein that we're giving you is the mutant part of the virus. The body sees that, it can learn how to fight it. If you're getting a virus, the flu is a virus. So if you get like a nasal spray, we've been giving people the flu vaccine for a long period of time. And
so there is a difference between how the flu vaccine works on this particular vaccine.
That's correct, because this vaccine is not a virus for that purpose. It's just part of a protein from the virus itself. So it's not going to multiply or spread it to someone who got it. So it's not compared to the flu vaccine or a polio vaccine, which actually, if you got it, you spread to someone else.
Okay. Hey, Reagan.
Oh, I was going to say that the reason why everyone's so excited about this thing is because of the science that has gone into it. Over these years of research on disease, we have figured out a way we may be in the future be able to fight any kind of virus through a technology, mRNA, messenger RNA, which is part of our cell. It's a signaling. It's a signal, in this vaccine. It's not the virus. It's a signal from the virus itself. We now have the technology that we're able to emulate signals from any kind of virus potentially that our population is in contact with. That's so quickly. Once they found that technology and they quickly brought that to the market, that's why we're so excited. Me personally, I peppered my step after I received my vaccine last week. I, like Dr. Duggins, had some pain localized in my arm where I received not even the day after. The day after my arm was a little sore, I felt a pep. And I know that was mostly psychological. Part of history. We're part of history. That's exciting, and that's a way to hopefully inspire kids.
So as we look at, go ahead.
The two that are available now that got the emergency use authorization, that's the Pfizer and the Moderna. Those are already being given in this country. Pfizer was first. Will I get Pfizer or Moderna?
I got Pfizer.
And they're both mRNA, and I agree with you, Dr. Ehart. I'm fascinated at technology intellectually, but just knowing that they're able to get, I call it recipe, the mRNA, the recipe, the spike protein on the virus. So it's very specific to that part of them that attaches to our cells, causes the infection. So if it can develop neutralizing antibodies to that spike protein, then the likelihood of what we don't quite know, do people still get infected after the vaccine? What we do know is people don't get the severe infection, which is killing Black people of color. So it is really powerful, the fact that has come to bear right now during this pandemic.
So the question is the question that we were going to ask next. If you had COVID, should you get the vaccine?
Yes, you're encouraged to get the vaccine even if you've had COVID, because we don't know how long your system is going to be able to protect you. I've had several of my peers develop COVID, come through and have the vaccine, and the CDC has encouraged anyone who had COVID to still take the vaccine. There's some who've actually gone through and checked their antibody levels and felt, well, they could wait before they take. But most people on that, and it's recommended to just go ahead and take the vaccine.
You're ready to be my next question. So we have this whole piece of, I've got the antibody, I need to worry about it. And if I have the antibody and so literally somebody just told me this the other day, I don't have to worry about it. I got the antibody. And my doctor told me that every time I come in contact with somebody who has COVID, that my antibodies get strengthened.
And I think the concern is we don't know how effective. You can have measurable antibody, but the real question is it neutralizing, effective enough to keep people from getting? There have been people who are reinfected, not a lot around the world, but so there's a question about whether presence of antibody equals effectiveness of antibody.
And the other issue is, people don't know how long they're going to be around to protect you. I mean, initially we thought 3 months, people say maybe 6 months. It's not really clear, how long those antibodies are going to be on to protect. So with the vaccine, at least you're given at least the same thing, 3 months or more, before it can wear off.
all took the vaccine. Do both of you get a second dose, or which second dose?
Both. Pfizer.
Okay. And so how quickly do you take that second dose?
3 weeks for the Pfizer vaccine, 4 weeks for the Moderna vaccine.
Yes.
But everyone had 2 injections rated. However, from your immune system is activated from the first injection and it's actually building up those antibodies from the first injection. The second is like a booster, get it over the top, increase the efficacy of protect you.
Yeah,
So, Dr. Stanley.
the studies have shown even after 1 injection of Pfizer, I think there's 50% effectiveness. But you still want to get the second. I want to be happy with 50.
Effective quickly.
I think I read where it was like 2 weeks. 2 weeks after the first injection, they were able to measure enough, of the antibody to say that there was 50% effectiveness.
So if I go get a vaccine today, in a period of time when I still need to probably be very cautious before it kicks, if you will.
Oh no, I was
The same rate of 0 as on 6 months down the road. We can't let off the gas with our mitigation efforts of wearing masks, avoiding crowds, in your hands. Just because the vaccine doesn't mean that we're 100% safe. What it is that if we're into contact, we are less likely to develop severity that could be life-threatening. We could possibly catch COVID, though it is more likely a mild case.
So let's reiterate that, because I want people to be very clear about this fact. Just because you get the vaccine does not mean that you cannot get COVID. It just means that it might be as severe. Just like if you get the flu shot, doesn't mean that you won't flu. It just means that you're not going to die from it.
That's right.
So I want us to be very clear about that we want you to get vaccine, but we will also be very conscientious. Getting the vaccine does not get red flag to go out, whatever you want to do, and be like, oh, I have the pass.
Correct. And you want to encourage the people to continue the mitigation system, as Dehart said. Because you don't know who else in the community hasn't had the vaccine to that date. You may have had it, but they may not have had it. And you may actually be encouraging people to expose others who are not vaccinated to the virus. There's a chance, which hasn't been proven yet, that you've gotten vaccinated, that you could transmit in the virus for certain. So it's once you get the vaccine, go ahead and continue mitigation things. Wear your mask, your hands, and large crowds. If you're in a crowd, make sure you're wearing a mask. And minimize the time that you're in any crowd. Once you get to a certain time, 15 minutes or more, it gets more likely for you to get infected.
Is there anybody that should not take the vaccine?
Yeah, I think the first that I will start is in the studies that were, there's some people who are definitely excluded from the studies, and what comes to mind literally is people who are pregnant, or expecting, So for instance, I would say that they should not necessarily get it. You have to discuss with your doctor on your risk factors, because you could be at high risk, from it. And so you have to make a decision as to whether to get it or not. And if you have diabetes or obese, those patients seem to do with COVID. So I think it would be better for you to see your, doctor first before, thinking about not. But definitely people who are involved in the study. So those are the category I would say they should not get it. The other category is, young persons who are studied were more than 16 years of age. So young were not studied in this study. So they're not also eligible for this vaccine so far.
Okay. Anybody we would say needs to, someone ask if they have COPD, get it?
Oh yeah, COPD is one, high risk people who don't fare very well if they get the disease. So definitely, if you have COPD or any lung disease or diabetes or heart failure, you need to get. If you have concerns, because of your disease, the best thing is just to call you and discuss the options, see if you get it or not.
Yeah, one more thing. It's anyone who has had a reaction to vaccines, they need to also discuss with their physician. Their physician may actually have to either do it or use certain options if they go ahead and do it. For example, there was a physician that went ahead and took the vaccine, but he has his EpiPen, which is sort of a rescue drug, because he knew that he tends to have severe reaction to the vaccine. So he was ready. So when he got it and he had it and he took his EpiPen and he was just fine.
So that was the questions that came up. If you have allergies, is that should you take it? And so again, seeking your physician and looking at what your particular allergy is would be the most prudent thing for you to do.
Mm-hmm. That's correct.
There's a question, and Dr. Stanley, this is in your. They said, what can we do? What would be eating? What should we be taking to boost our immunity? And I know that you are a huge proponent of food as medicine.
Yes.
So talk to us a little bit about that. What should we be doing? What should we be eating? What should we be taking right now to boost our immunity?
Sure. And, most know what I'm going to say intellectually. We've heard there are certain things that your immune cells are either going to benefit from or it's going to be a detriment. And I'll say sugar, simple carbs. Sugar actually does a couple of things. It actually blocks the uptake of vitamin C, the immune cells, and we know that our immune cells. So the more sugar, simple carbs that you have, it's going to make your vitamin C less effective in supporting your immune cells. And we always are. During this pandemic, comfort food has been comfortable for us, but it has been detriment because the more we eat comfort foods, the more inflamed that we become, because of sugar inflammation. COVID is inflammatory because when you look at the immune system is beneficial, but it's inflammation. When we see patients get deathly ill, it's not because the immune system wasn't working sometimes. It's just that for some people it's over. It's like our immune system disrupts. So in the process of trying to kill the virus, it produces a lot of different cytokines and things that are in the human body. So I start sugar. I mean, sugar should be limited as possible. Certainly, eating green leafy, we know this, into eating vegetables and fruits limited because you can get in trouble with that sugar. I know some people don't have the access to that, but I think that all of us can do better, even if it's just limited, drinking more water, getting more work, getting 7 hours of sleep. Those things that we are not important are extremely important. And for color, again, I overstate this. Absolutely must support vitamin D. Right now, it's not a perfect scenario. Some people can't get levels measured, but you can assume if you are a person of color, pigment in your skin, your vitamin level is less than. I can only tell you experience with hundreds of people in my functional medicine practice. I think I've ever seen a person of color have an optimal vitamin level. And one thing the pandemic has revealed, and now there are things that have come out of this pandemic that demonstrate the association of low vitamin with not only getting infected in severity of COVID. And, I'm not going to use the word treat, although there's a couple of studies that use that word. But I tell you, if you don't do anything else, support your vitamin D. But certainly you can make some diet and other lifestyle changes.
Dr. Dehart, you in your head, are there any other things that you would suggest? You're muted, baby.
Yeah, I agree with all of them. And one we said is about access to, healthy foods. And like the disease has really brought to light the disparities between the haves and have-nots. In the places that I work with, you can't even say between, black and brown and white. It's between the haves and the have-nots. In our population, they don't always have access to health foods. There are foods that they things out of a box. And those are the foods that are highest in those simple sugars, fat. They don't live in neighborhoods safe enough to get outside, exercise. We're in the dead winter where there's no sunshine and access to funds to activate our vitamin D. So the most thing that I've been able to tell people, stay away from the fast food and at least take a multivitamin. That's more water. Stay away from alcohol. Try your best to stop smoking. And so we have to give a grace. And people always do the very best thing to do. The best you can do is the vitamin and get outside and walk up, walk and back home, a few of the week. Please do that.
Yeah, I totally agree. So our comfort food needs to be green vegetables. So we need to be eating greens and cornbread versus Cookies. Is that what you're saying? No, I mean, come on now. You got to give me something. Come on, Dr. Stanley. Come on. We have this conversation all the time. I mean, you got to give me something.
You know, I'm hardcore, and I don't know whether it's because I'm older, and I've actually seen people do these things, even when they don't have great access. So my thinking, and I think it's because I am older, and there's just power that we do still, and I don't shame people, I don't beat people up, but I'm going to make sure that information, so you can make the choices, and you can make the choices. There just isn't a whole lot. We're going to live and live well beyond this pandemic. Yeah.
Hey, do you want to share with us your slides?
Oh, sure. Yeah, just really quickly. And it's really going to reinforce what we've all been saying. I'll just move through them really quickly.
I think he has them.
Mm-hmm. And what I really wanted to do with these slides is, people are for the vaccine. I want out the truth of what was found in these studies around symptoms you can expect. Symptoms that you can expect that are common, that you don't have to be scared of, because the symptoms reflect your immune system responding to the actual spike protein that's being put in your body. So I just want people to know truth. I'm a visual learner, and I'll move through. This is just a reminder, this slide, of how more Blacks, African American, Hispanic, Latin, how much more fully, and Native Americans actually die from COVID. So this, I would say 3%, 3 times as much mortality in the African American community. Next slide. And this is comparison, just a big glimpse of, we've talked RNA vaccine and how it works. I compared Moderna, and again, the doses, 21 days apart, Moderna 28 days apart, and Pfizer had participants 6 and older, Moderna participants 18 years. But both of them were 94 to 95% effective 2 doses, and at least 50 after only 1 dose. Both of them have gone through rigorous safety assessment, their emergency use, and are being used. And a lot of people say, fast, I don't. Well, you have to know that, like Dr. Diaz, there was science going on behind the scenes way before this that made DNA seeming fast, but you have virology working on the mRNA. It's their life. And phases 1, 2, 3 phases in they were stacked. So instead of, one and then phase, they did have to do some things relatively simultaneous. Make it seem like fast. It did. Let me say that it did happen fast without the safety guidelines, pre-vaccine. And there were 20,000 participants in phase 1, now 3, because they're still in phase. Next slide. And here's what I say to my friends that I influence and my patients. Expect, because 8% in the actual study had arm injection, 4.1%. It's a pain at the injection site. Then wonderful. Muscle pain, 38.3%. Injection at the injection site, and so on. Some expectation is some discomfort systemically. So almost 63% of people had fatigue, 6% headache, chin pain. So this is scary, but just so you have these symptoms, you won't get something. Next slide. These are common or rare, but serious and reportable things can potentially happen. Anaphylaxis, and we've several people, I think with Pfizer, maybe one with something called inflammatory syndrome, which is seen in children, particular syndrome. Cases of COVID after administration of the vaccine, hospitalization or death, or injury, and this is right out brief, so I didn't make this up. Shoulder injury related to vaccination within 7 days, and there's even been a report of something called Johnson syndrome. Uncommon, rare. Serious. Next slide. And you ask them, who are the hospitals? And they call the recommended with discussion and consent. So that's pregnant women, people with disease, people who are immunocompromised either because of cancer or immune disease where they're on lotsons. So over time, we're doing safety data. So we're starting to get immunized. There will be younger children in some studies. There will possibly be known pregnant feeding women who are in studies. Right now, we're not intentionally in the first phase 1-3. There is no blanket. Basically, you just and get from people who are considered high-risk groups. And the advisory commends vaccine, but combination with an OB doctor. What's still unclear about the vaccine, whether it's effective and safe for children less seen, but they're going to start some studies in younger. How long the vaccine protection lasts? Will we have annually like we've seen? We don't know that yet. And the safetiveness in pregnant and breastfeeding women, but they will start at that closer as well. Fine. We all were in agreement. Immunized patients should still adhere to all the COVID precautions, even once you get even when you get your vaccine. Masks, social distancing, hand washing with high-risk contacts. The next. I think that's it. That's it.
Thank you. We're getting some great feedback on those on that information. There's a question: can drinking water or eating lemons and breathing in steam be served as a home remedy? And I'm sure looking at all of the things that we've done, thinking about we can create some concoctions to make some stuff away. Is this an effective remedy or effective thing to doing?
Well, I'll say this, lime and lemons, getting from that is vitamin C. We know is beneficial to the immune system, but it's certainly not a treatment. It's not gonna, I don't want people, it will treat COVID or cure it. It'll provide to your immune system important, like C. And the hot steam will help open you up, but not cure or treat that I know.
So anybody else have any, things that at the end of the day, these wives' tales, if you will, and so people kind of start. Fake is a great tool, but in some ways to share all of these things that people have tried. So, what are some things that you're recommending for? And anybody can answer this question. What are you're recommending for people? If I think Dr. Yongo, I'm gonna get it right. I think he kind of said earlier that there are some that you could be doing at home, but you don't want to make it worse. So what do y'all recommend?
I think mostly just supportive treatment. At home, fever, you can take some Tylenol or ibuprofen. You can take syrup if you're coughing too much. There's other suppress the cough, keeping you up at night. So it can help. As regards to the other, herbal remedies out there, people have talked about garlic, ginger. I'm not sure if they help, but as you're not doing something in overusing it to a toxic situation. I mean, if you have chew on garlic or chia, that's up to you. But I think it's a significant helpful alternative, so as Dr. Stanley mentioned. So the regular things that we're used to is what you should do. Tylenol, more treatment, or something just treat you.
You chewing on garlic, have to worry about social distancing. Go ahead, Dr.
The thing that I always try to explain to people is that anything that causes a to remember you have to stay hydrated. Getting dehydrated is one of the worst things you can do. Sometimes you feel tired, you feel sick to yourself, you just you don't have the energy, like you have the energy to get up and drink something, but you need to drink rehydrating fluids. If that's just water, that's great, but you need to make sure you're staying hydrated anytime you have anything that's associated with a fever, because dehydrated really, and that can put you in trouble. So Tylenol, Motrin if you need to, but definitely stay hydrated. I'd push it over again. And just one other point, I don't think anyone is saying that taking the vitamin is going to end COVID or is going to treat COVID. I think everyone understands boosting your system, and your system hopefully will then fight the disease.
So I ask a question, is a Z-Pack or steroid pack good with helping with COVID?
So, there's not really strong evidence for this. We do it in the hospital, but I think that needs to be to the doctor first before they can prescribe that, because the treatment of it the dosing is different. So I would not necessarily recommend by those at home by themselves, way to guide you through it. Some patients might not qualify for it because they indicate patients who have severe disease requiring oxygen. That's when we consider steroids. At home, and you're not that sick, then I think doing the pack at home is probably not of benefit to you. And if you really need a steroid, you should be in the hospital, more than being.
And I believe some evidence that if you use steroids too early in the infection, you can actually affect the immune system negatively. So I think the time, like Dr. Olinga was saying, the timing of steroids is important. And generally hospitalization and the dexamethasone, that's later or with more severe infection, as I understand it.
And again, like we said before, there is no cure. There's not just a cure for it. It's all supportive treatment. Just how kind of like minimize the inflammation in your lungs. And that's why this vaccine is a game changer. It's a pivotal moment to take advantage of and stay away from it. Nothing else that can protect us from the disease or cure the disease, so to say.
Just a clarification there again is that azithromycin, which is an antibiotics. Antibiotics do nothing for the virus. Antibiotics does not stop a virus. It's no antiviral properties. It's been shown over and over again. If you get a secondary infection, yeah, most likely you need in the hospital so that doctor can take care of you. He will give you the right antibiotic.
So, and I think this has been said before, antibiotics not affect a virus, and that is what this is. It's a virus, and so we want to make sure that we are giving correct information. Thank you, Dr. Duggan, reinforcing that this is not, antibiotics do not help with a virus. All right, so last question is, if you're taking vitamin D, if you are taking those vitamins, what are, how much is too much? What should we be doing? I know Dr. DeHart said if you can't take anything else, then just take a multi. But if I'm trying to, you said, Dr. Stanley, you said that most of us are vitamin D deficient. So what should I do?
Well, really, you should have a baseline vitamin D level drawn. So because that really guides dosage in vitamin D3. A lot of times people don't have that benefit. I advise not taking vitamin D because you can't get your on. Even if you started at 2,000 IU, and that may sound like a lot, but in my practice, where I do get a chance to measure and guide the dosage, my average client requires 5,000 IU just to even get to 50. But that's my experience. So ideally, you'll be able to have it measured and then let that guide. If you can't do that, I would say stay, and you can check me. There's a Dr. Hollick, L-I-C-K, who is a researcher, well-known vitamin D, who can guide you. He'll say higher levels. I mean, if you're unsure, 2,000 is going to help, 2,000 IU daily, but you probably need more to be guided by measurement.
All right, we have minutes left. So I'm going to give you 30 seconds to tell us one last thing you want people to know about the vaccine. And you should go out there and take it, given the opportunity. Dr. DeHart, start.
It's safe. It's proven to be safe. I would much rather have had a sore arm for a day and a half than to be calling my personal doctor that I cannot breathe. Breathing is one of our most, it's a function that we don't realize how important it is until we can't breathe, until we see a patient cannot breathe. So take the things that we can breathe.
Dr. Oyanga?
I would say that, for us to stop the pandemic, as many people need to be vaccinated, there'll be numbers out there, 70 to 80%. As we are individuals, we are part of community, African American community, but we're also part of the nation. So we have a responsibility and to us to get the vaccine, but we're responsible to the nation to get a vaccine. We can stop the pandemic. Without which, we're not going to achieve the control of the pandemic. So, it's not that we don't want to be the weakling, at this pandemic. Without getting the vaccine, unfortunately, that's going to be the case.
Dr. Duggins.
Yeah, definitely get seen. It's safe. It's been proven. Continue to do your workout. It's one thing that a lot of people don't stop to think about. Stay hydrated. In addition to the vitamins that you supplement with, that's important. So get the vaccine because it's good for you and it's good for the community. It protects you and those around you.
Dr. Stanley?
I agree with everything that's been said. We are in a tailspin. It's dire right now. And the only way we're going to be on the other side of this without hundreds of thousands or more people dying, particularly people of color, is if we get this vaccine. We have to do it for ourselves and our community.
Thank you all for participating. We appreciate you. On behalf of Wichita African American Council of Elders and the Black Alliance, we want to make sure that we express to you, the community, how important it is for us to stick together. As someone mentioned, and Dr. Stanley mentioned earlier, we are in Kwanzaa. This is time for us to come together with collective work and responsibility. It is up to us to take care of the village. I also want to again mention that last week we discussed the impact that the pandemic had on mental health. So if you go to the Black Alliance page, it's not there yet, but it will be here in the next couple of days. We will have a mental health brief that you'll be able to download, that you'll be able to go on. There are resources both locally, statewide, and nationally for you to be able to get some information about mental health and things that you can do. There'll be some really nice little practices in there that you can do and use to make sure that you are staying on top of that. Again, www.wichitablackalliance.com or the Wichita Council of Elders Facebook page. And again, don't forget to use our text alert system by dialing 484848. This is Michelle Van, and we are so appreciative of you taking the time to be with us. Thank you, Roland Martin, for live streaming. Without you, we would not be able to reach the amount of people that we have been able to reach, and we appreciate your platform for this discussion. Remember, we are on Facebook, we're in Periscope, we're in YouTube. Make sure that you go through, invite your friends, share with your friends. Even though we're over, there is a multiplicity of times in which Mr. Martin will share with you this particular show. And so we want you to make sure that you're sharing. Happy Kwanzaa, Happy New Year. Please stay safe, wear your mask, wash your hands, and stay away from other people. We love you, and we want to see you in 2021. God bless you.
It's a fact. African Americans have higher costs, hospitalizations, and deaths from COVID-19.
Come on, people, be smart. Avoid large crowds, wash your hands frequently, and mask up.
Going to crowded bars right now, it is dangerous for you and the people that you love the most.
Be patient. Those days will come back if we take extra caution for a few extra months. Got this.
Keep the holidays safe for every generation of your family. And protect your scalp.